listen in, but I'm like multitasking just to see if there's anything that comes up that, we need to follow up on. And I'm like, it's a long afternoon.
Long afternoon, but we're glad to be here today. And let me welcome everybody to week 5, January 12th, regional report out for Southwest Kansas. We're glad to have you here today. We're here at this time every week at 4 o'clock live on this YouTube channel. I encourage you to sign up for the email at covid.ks.gov/report-outs, covid.ks.gov/report-outs. And you can sign up to get this regional email. We have attachments from some of the things Seth's going to talk about, websites, links, and the dashboard, of course, that we put together. So this week we do have Seth Conkle. You haven't seen him here before, though. He's been a part of the regional report out calls from South Central Kansas, and but now he has been appointed as the special advisor to the governor on the vaccine, and really helping lead in the state and organize all this for us. So Seth, thanks for giving of your time. I know you got a lot of demands on it right now, but can you please just spend some time walking through what the plan is that the governor rolled out?
Yeah, absolutely. Thanks, John. We did get the plan kind of rolled out, or not necessarily the plan, more so the priority plan rolled out last week, so Kansans can kind of start to figure out where they fall on the spectrum of and expect when they will be able to get a vaccine. Before we jump into that in the website, I want to go over a couple of definitions that I think we're seeing some people get hung up on a little bit. So first off, the process is, or the allocation, which is the process of determining how much vaccine is happening from the federal to the state to the locals, and even from the local health department to potentially other providers in their community. So that is just a paper, a database type transaction that is not physically moving vaccine around. So when we start talking about physically moving the vaccine from warehouse to warehouse to from the federal government to the state government to the locals, that's kind of the art of distribution. And so just think of, you order a package on Amazon, and in many cases, that's how it's getting to those local providers directly from the federal government. It's getting shipped via common carriers. And then finally, we have the dispensing, or the actual getting doses into people's arms. So that may be reported out as doses administered, vaccine administered. That's the kind of the concept of dispensing. And then finally, we have point of dispensing, or a pod. And this is a term that's been around for 10 to 15 years, especially in the public health realm, about the location that you go to receive a vaccine. So it's the same thing if somebody calls it a vaccine clinic. We're talking about one and the same. Pods maybe are a little bit more geared toward the mass vaccination, to where it's a bunch of people trying to get through in a large location, like an arena, a school gymnasium, something like that. Not your one-off vaccine appointment that you may see at your local or through a regular visit to your primary care provider. So the reason these definitions are important to understand is because we have the allocation through the dispensing, and that's actually a fairly large amount of time. Could be anywhere from 7 to 10 or 11 days from the time that the federal government tells the state, this is how much you have, where do you want it to go? The state answers that question. The feds then ship it out to the local levels. The locals receive it, or the providers receive it. They stand up their clinic or let their patients know that they can start coming in to get it. And then by the time that paperwork of the actual dose in the arm gets entered into the state database for us to record it as a dose administered, again, it's a fairly lengthy process. So that's why we're seeing a lot of data lags. It was reported a couple of weeks ago that Kansas was at the bottom, and it really, when we got down to it, the folks at KDHE started researching. It was due to just data lags, and now you'll see that nationally we're up in the middle of the pack and kind of the top tier, or one of the top 2 tiers for doses administered across the country. As part of that rollout, though, the governor was able to announce a new website, and that website is kansasvaccine.org. .gov. That's why I have to keep looking. .gov. kansasvaccine.gov. And this is going to be your one-stop shop over the next 6 to 8 months for anything COVID vaccine related. As you can see right here in the middle, is the total number of doses as of yesterday afternoon, again, reported into WebIC. There's probably some people that are still using paper methods at their clinics, and they've got to enter those into the database and get them uploaded. So those may not have counted as of yesterday, even though it was actually administered yesterday. This website also has information about vaccine safety. It has information about FAQs and frequently asked questions that we're seeing a lot of at the state and even local levels. And then a section to distinguish between fact and fiction, or kind of to stop some of those rumors that you may be hearing. But ultimately, this website right now, what everybody wants to know is, where do I fit in, and when and where will I be able to get vaccinated? So in order to look that up and kind of help Kansans figure that out for themselves, you need to come to the availability page. When you click on that, there's going to be two things that we want to look at. If you want a high-level overview, you're going to look here at the phases by population. When you click on this link, it's going to bring up this document. It's a one-page document. It's, again, very high level, tells you the phase and who's generally being served in that phase. And then down here, the time frame that we see before we move into the next phase. So I understand completely, obviously 65 and older is easy to define, but when I talk about high contact critical workers, well, what does that mean? So if you go back over here to that main availability page on the kansasvaccine.gov website, you can look at the vaccine prioritization plan. When you click on that, it's going to bring up a 10-page document that more clearly outlines each of these segments within each of the 5 phases. So when we look at that high contact critical worker, and I'm not going to go through this entire document today, but there's 3 pieces of information that you need to see on this page. The most critical piece of each of these sections of these phases is the definition. So the definition is truly how you as an individual can determine whether or not you fit into this phase or not. The second section, the description, just helps give you a little bit of background and knowledge around how the definition was developed. And then finally, some examples or groups. I will tell you that these groups and examples are not all inclusive by any means. It really comes back to the definition. And the reason I want to point that out is because as a retail worker, if you work for a retail shop or retail company and you're their accountant, but because of all of this, they've said, hey, go do all of your work from home, then you're missing a key piece of the definition, which is that high contact. So again, if you're working for a retail entity, but you're doing it from home, then you don't technically meet this definition. So that's why this definition is far more important than the groups listed. Now, the last thing I would share before I turn it back over to John would be that if you don't see yourself in the definition, go to the next one. And can you continue down until ultimately you may find that you are in phase 5. And again, we are going to have plenty of vaccine available for everybody that wants to get both their first and their second dose available. It is going to take a few months. This is a marathon, not a sprint. But I think it's comforting to know in the last not even a month, we've been able to get over 84,000 doses administered. So again, with that in mind, we look forward, John, to being welcomed back to this group and other groups to share information as new and evolving information comes out about vaccine.
Thank you very much.
Absolutely.
Any questions while we have Seth available to us, Jeanette or Audrey, that you'd want him to clarify?
No.
He does a good job, doesn't he? I'll tell you. Been walking with him all day.
Well, thank you guys, and we'll let you enjoy the rest of your call.
All right. Thank you, Seth. All right. So now we have a picture what the vaccine plan is for the state. Now let's dive into the dashboard for the Southwest region. Audrey Dunkel here is in Mary's place. She's with the Kansas Hospitality Association. They are the group that's responsible for so graciously putting this together for us. So Audrey, thank you to you and your team over at the Kansas Hospital Association. So I got notes for myself here. I'll reference last week for you. Generally a positive story for Southwest Kansas. So when you look at hospitalized, confirmed, or suspected COVID patients, last week at 50, this week 55. But over here, ICU beds with COVID or suspected COVID was at 12 last week, 9 this week. And last week we showed only 3 ICU beds available, now 9. So up from 14% to 41% availability. That's good for Southwest Kansas to have some breathing room there. It's been a few weeks. And then coming down here, we're seeing this plateau at least. Hopefully, it's not a sign of an uptick. Glad we're not up here over 1,000 where we were, which created some real capacity issues. But we don't want to get back up there. And so it went from 465 up to 517 this past week with a positivity rate of 13.26%, which is higher than the state average. So we want to, and this is for the region, according to KDHE, 13.26%. So we really want to keep an eye on the spread while we have some capacity in the region. And so, the second side of this gives us the ICU census, the bed census of non-COVID versus COVID patients, the availability, and then what percent of the population of each of these counties has tested positive thus far in the journey. So let me come off of this and we'll go to our friend Jeanette to give us an update from Public Health.
So I have reached out to my regional partners, and most all of them are saying that they are continuing. They've seen a decrease in cases before Thanksgiving, and this week they are starting to gradually increase. Definitely, we're not seeing the increases like we did back first part of November, end of October. So that's been really good. KDHE still has disease investigators and contact tracers available for health departments. If we're too overwhelmed and we need help to do the disease investigations, that they are available to help us with that. Most health departments have now received the COVID vaccine and are working on the priority groups, getting healthcare workers and first responders and those in phase 1 vaccinated. So there's been, I feel, a little bit of confusion as to what we're supposed to do when you have vaccine left over. When you open a vial of vaccine, you only have so many hours to give it. So if you have, I have the Moderna vaccine. I don't open a vial until I have 10 people scheduled to come in and get that vaccine, just so that we're not wasting any of it. So many of them, healthcare workers are hesitant maybe to get the vaccine. And so, they want everybody else to, some others to go first and make sure that they survived the vaccine and didn't have any side effects. And so as everybody is getting their second doses, then I can see more healthcare workers maybe more acceptable to getting the vaccine. So many health departments are planning, how to do a pod and, trying to gear up to give the vaccine to the public. So as we have many of our elderly population calling and it's like, well, we want on a list, or when can we get it? And, as of right now, it's really kind of unknown how soon we'll be able to move on into the next several phases. So we make lists and keep reassuring them that the vaccine is coming. But we would, let them know as soon as it's available. So I think that's all I have for today.
Hey, thanks, Jeanette. A couple things important for folks to know. So one interesting thing is I think we're over 3 million doses delivered across the country at this point, which is, good. It's always better, I guess, to know someone personally that's been through it, which I have a lot of friends that have now already through their second dose of the vaccine. Also, just, so Seth as special advisor is helping coordinate the statewide response. When we move into phase 2, which will be later this month or by the 1st of February, it will be up to your county leadership to take that category apart and figure out how to prioritize it and administer that. And so please be listening to folks like Jeanette and her associates in public health across this region to learn, how they're going to set it up and administer it. And like she said, they're working on their plans right now. And I know they're as anxious as anybody to be able to deliver it out to their communities, in a responsible way. I heard earlier today that Kansas only received half of the doses that it was said to have promised in December that we'd have at this point. And so, still with all the problems, very amazing that we got the vaccine set up and it's out and going. And thankfully we've gotten 85,000 at least doses out in Kansas at this point. So appreciate that, Jeanette. Thanks for all you're doing and the role that you've played up to this point and the important role in vaccination that you're going to be playing moving forward. Let me pitch it over to Audrey Dunkel. Audrey, if you can give us a report out from the hospital side of things.
Great. Thanks, John. Well, it looks like things are looking better in Southwest Kansas. As you mentioned, the number of ICU beds available has increased. That percentage has gone up, and we've seen it be as low as 15% in the since we started doing these calls. So feel like that's great. Staffing numbers are looking stable, which has been another one of the big concerns is as staff get sick or they have family members get sick and they have to quarantine, it becomes a struggle for the hospital to maintain their staffed beds. The Southwest region cache has been restocked with additional disposable masks and gowns for our region. Again, this is the stuff component that we always talk about. Do we have the appropriate PPE? Is it available and ready for a surge? So that is being resupplied. Most facilities are administering their second dose of the Pfizer vaccine, or some of them their first dose of the Moderna vaccine. I know everybody is very happy to have that. We talked about what happens when you get the first or the second dose. And I think what we hear anecdotally is, yeah, after the second dose is when you start to maybe have fever, chills, some of those kind of issues as well, but goes away very quickly. So feeling very positive about that. Mask mandates are continuing for another 30 days in many counties in Southwest Kansas. That includes Finney County. So still being really careful out there. There is some confusion as to whom the next vaccines will be available for. And I think we heard that as well as we're working through this vaccine process. Everybody's concerned about getting covered and being taken care of. Again, the over 65 crowd definitely starting to ask the question because they're in that next group to get the vaccines. Most of the classrooms are back in session in most of the counties, and the well health testing is available in several of the Southwest Kansas counties, so people can go and get tested. And we know that St. Catherine and Garden City is working with the county health department and with the Genesis Clinic to planning the rollout for the public vaccine. So making sure that you get good, big groups of people taken care of. So moving forward, crossing our fingers that Southwest Kansas continues to be in better shape next week. So thanks, John.
Audrey, thank you very much. Here as a wrap up, a great group here out of Southwest Kansas helping us out. We like to end with a bright spot. I have a bright spot that Mary had sent me. And I love this thing. So a Turning Point Church of the Nazarene in Garden City put a care package program together. I got you can get a quick look at it here, but the essential idea is if somebody or yourself has to quarantine due to a positive COVID-19 diagnosis, they said they want to bring hope, comfort, and encouragement. So if you call the church, they'll deliver a care package to your home. So just a great way, someone reaching out, caring into their community for anybody who is stuck at home and having had to do that with a daughter who tested positive. Quarantine, hardcore quarantine, isolation, not a whole lot of fun. So when people reach out to bring dinner or a care package, it goes a long way. So great to see Turning Point Church in Garden City doing that. And we love catching people doing something right, bringing a little kindness into the world. So, hey, please tune in this time next week, 4:00. the Southwest Kansas Regional Report Out Call. Again, sign up or encourage your friends if they want to hear covid.ks.gov/report-outs. So thank you, Audrey. Thank you, everybody else. Have a great day.